If you have a dog that's been diagnosed with a parathyroid tumor, or if you're interested in the symptoms and treatment of a parathyroid tumor, I'd like to share with you some information based on my own experience with my dog Asha, who recently had that diagnosis. I'll be talking about that as well as my thoughts on expensive or complicated surgeries, particularly for older dogs. As well, I've got some ideas on creating trust and good communication with your veterinarian in order to support the best outcome for your pet. This month, my Asha turns 13 years old. She's been a pretty healthy dog for most of her life. She is epileptic, but she hasn't had a seizure for almost 5 years, which is pretty amazing, really. She was a really terrified little dog when I first got her. She wasn't well socialized, but she has come a huge long way since then. She's also been a very active dog, but she has slowed down a bit over this last year. I brought her into the vet earlier this year for a couple of broken teeth, and before we did the tooth extraction, we did a geriatric blood panel. The blood panel showed some elevated calcium levels, and that can apparently be sometimes indicative of cancer. So she also had a chest x-ray, and her anal glands were checked for tumors. Everything checked out okay with that, and we went ahead with the tooth extraction, which worked out really well for her. I went back later, a couple of months later, and retested the calcium levels, and again, the calcium levels were high. So of course that's a concern. My vet recommended doing a specific test, which is, I think it's called an ionized calcium test. It's a blood test, and if the levels are high, it really points to the dog having a parathyroid tumor. So we did the test, and her levels were definitely high, on the high side, so it did point to a parathyroid tumor. She didn't have a lot of really visible symptoms other than a lower energy level. She was drinking a little bit more water and maybe peeing a little bit more than normal. I've heard that dogs can sometimes lose appetite. She definitely didn't. She loves her food. That did not change. The only thing I could really notice as a symptom, other than the drinking and peeing, is she did sometimes vomit after her morning breakfast, which was not her normal response. That was a little bit of a concern. As well, she has a little dog bed, and she tended to lick her dog bed quite a bit, and I always thought that was like a pain-related thing. Sometimes you'll see a dog licking its joints because they've got a bit of arthritis, and because she had the tooth issue, I thought, well, maybe it's her teeth and it's a comforting thing. But even after the tooth extraction, of course, she'd have some pain initially, but she's even doing it now. She's not yet had the parathyroid surgery, so there's something going on there. The vet says, that could be a bit of dog dementia with high calcium levels in the system. You never know if that could just be affecting her brain somewhat, but I tend to think that behavior was more pain related than anything else. Now, to backtrack a bit, my vet did ask me before we proceeded with the ionized calcium testing whether I'd be willing to consider actually going through with parathyroid surgery if the testing ended up indicating that was the issue. I think it's important to ask yourself those questions before doing this, or any kind of testing really. What kind of actions will you take if the testing is pointing towards a specific surgery? It's nice to know what's going on. In Asha's case, she's been a fairly healthy dog, but if she had other health issues, I'd be really considering that possibly the surgery would be too risky for her. So you have to really look at the overall health of the dog, particularly a dog that is older like her. I mean, she's going to be 13 this month. She may only have a couple more years, even with all the best outcomes with surgery. So again, you have to consider your individual situation. For me, with Asha, I would be willing to go through with surgery because I know that could potentially solve her health issue right now. The other issue is that it can be a very expensive surgery, and you need to know if you have a veterinarian that has that specific skill set to be able to do that surgery. For me, I do have access to a veterinarian an hour and a half drive from where I live who can do the surgery, and so it's a doable surgery for me. So the next step was an appointment with the veterinary internist. The internist appointment consisted of the consultation, the ultrasound of the neck and the abdomen area, and Asha was sedated for that. Also, she had, obviously, her neck and abdomen were shaved in order to do the ultrasound. The internist made the diagnosis of primary hyperparathyroidism with enlarged right cranial parathyroid gland. And also, Asha has a bladder stone, which was caused by the high calcium in her system. Costs are obviously going to vary depending on the situation, but for me, the consultation and ultrasound cost just over $1,000, and the surgery itself is quoted to be between $5,000 and $6,000, so not an inexpensive surgery. And none of that includes the previous chest x-rays, physical exam, blood testing, and tooth extractions that all happened this year. The biggest risk and probably expense about the surgery is I'm told that the calcium can actually go too low after the surgery, so it needs to be monitored very, very carefully. Asha is predicted to be overnight at the vet clinic, possibly 2 nights, so we're looking at 48 hours. So there is a critical time period after the surgery to make sure that her calcium levels are regulated properly. My main consideration with going ahead with the surgery, particularly because it is such an expensive surgery, is what is her health prognosis with or without the surgery, and will this actually fix the problem? After meeting with the internist, I really got the sense that this will fix the problem. My understanding is that Asha's kidneys are in pretty good shape and her health is pretty good, and most of her symptoms really are due to this hyperparathyroidism. So leaving the disease untreated will eventually cause kidney damage and can also damage other organs. I just went through kidney failure with my other dog Sprite last year, who died in July of last year. And kidney failure is a tough one. And if I don't have to go through this with Asha and I can give her some quality of life, even a couple of years more, I'm willing to do that for her. She's been such a healthy dog and has not cost me very much vet-wise over her years, and I just feel it's the one thing I can do for her. Now, every situation is different. If Asha's health was not as good as it is, I don't believe in just hanging on to a dog and keeping them alive if they don't have a good prognosis of quality of life. So again, I'm making my choices based on my own situation, and basically that's not going to apply to every other person. You have to make your decisions based on your dog, your dog's health, what your veterinarian suggests and advises to you, and your own gut feelings about what's right for you and for your dog. One of the biggest considerations for me really is the general health of the dog and the prognosis for a good outcome. You know, people will judge you if you spend a lot of money on your dog, and people will judge you if you don't spend a lot of money on your dog. And honestly, I think it's very individual. I don't judge people's individual decisions because every situation is completely unique. I think that if the decision is made with compassion for your pet and compassion for your own life circumstances, then that is the best way you can make a decision. Everyone's life circumstance is very different. It's a costly surgery, and every pet's health situation is unique. So you have to weigh a lot of different variables to come to the decision that's going to work for you. About communication with your vet, I think it's really important to have open dialogue and clear communication with your veterinarian. I was once in a situation where a misdiagnosis led to the unnecessary death of my pet. I wish that I had asked more questions instead of blindly trusting what the vet was telling me. Mistakes happen, I understand that. I want to have a good relationship with my vet, and I think it's really important that we're fair to vets and that we're not rude and demanding and confrontational, because that isn't going to result in a good relationship with our vet. But if you have a question, ask. If you don't completely understand the surgery or the potential outcomes of the surgery, ask. If you don't understand some of the terminology, ask. If you aren't getting some of the answers that you need, it's okay to seek out a second opinion, even if that does cost you another vet bill. Sometimes it can save your animal's life. I know it's got to be very frustrating for vets when we go to Dr. Google and we conjure up all sorts of scary things that we don't understand, and we maybe seem like we're creating fears out of nothing. So ask your vet if there are resources where you can learn about the specific situation that your pet is experiencing, and do they have a website that you can look at? Do they have resources or pamphlets or things you can read? It can never hurt to know more about what your vet is doing and what your pet is going through. You can also access copies of your pet's testing and x-rays or notes. Anything that you've paid for your pet, you can ask for access. Often they will email you those results. Personally, I think things work best when you and your veterinarian act as a team, both wanting a good outcome for your pet. In my opinion, having an adversarial relationship in this situation is not going to benefit the veterinarian, you, and especially it will not benefit your pet. So you can create a team atmosphere by not only learning more about your pet situation and understanding it fully, but also by showing some gratitude to the vet and to the staff at the vet's office for everything they go through. They go through all of our hard decisions. They go through all sorts of grief and difficulty and challenges and pain and tragic situations almost every day of what they do in those offices, and include some really, really tough decisions and situations. And so I think it's so important to also express our gratitude for what they do for our pets, and for when they do share information. It's so valuable to me when they answer a question of mine and don't treat me like I'm some sort of idiot. And so I like to show gratitude and give my thanks for when they're willing to give their time to do that. I think it's really important we all show gratitude, and that will create a better situation and relationship, and it will ultimately benefit your pet. So Asha's surgery is coming up on Monday. I'm super nervous, but I'm going to talk to the surgeon ahead of the surgery and just prepare any questions I have, and hopefully those answers will put my mind at ease. So wish us luck. I will be back with another video report to talk about how the surgery went, and hopefully if you're going through something similar, it might give you some insights or help you out going through the recovery stage of your surgery as well. When that video is done, I will add the link, probably somewhere here, and if there's no link there, then probably that video isn't done, or you may need to look at the description below, because sometimes if you're on Facebook, you won't see all the links. If you've had experience with this surgery, I would love if you could share your comments on whether it was a positive experience. And also, if you have any of your own tips on how to maintain a really good relationship with your vet, I'd also love to hear any of your suggestions and ideas about that. So take care, and I will see you soon.